Okay, so the first modality for cold that I chose to do is an ice cup or ice massage. The first thing I want to do is have the athlete sitting in a relaxed position. You can even put your leg down if you want to. I want to inspect the skin to make sure there's no open wounds, no infection or condition that would allow me not to do this. I want to instruct the athlete to directly put the ice cup on their leg. I want them to pull distal to proximal. I want them to lift the ice cup up after they're at the top to go back down to help with swelling. 3 indications of doing an ice cup or ice massage would be rapid cooling of the skin, if there was contusions over a small area, or to reduce any muscle spasms. 3 contraindications would be if there was fractures or if the athlete had any type of circulatory system problem, or if there was open wounds. The temperature of an ice cup is frozen water, so it's typically 32 degrees Fahrenheit or cooler, depending how it's stored in the freezer. It tends to warm up and start melting over time because of the heat from the body, which allows the method of heat transfer to be conduction. I would have her do the ice cup for, moving just proximal, for 7 to 10 minutes. Okay, so the mechanical modality that I chose to do is milking massage. Before I start with the massage, I want to make sure the athlete has clean, dry skin. They're in a gravity aiding position, and I also want to inspect the skin prior to treatment as well as after to make sure there's no infection, skin condition, and nothing changes too dramatically after the treatment. 3 indications would be to improve blood flow or stimulate blood flow to the area after an injury, as well as increase range of motion and decrease swelling and anemia. 3 contraindications would be if there was a fracture, or if there was open wounds or skin infection or condition, like mentioned before. Normally, typically, the duration of the milking massage is anywhere between 5 to 10 minutes. Okay, so the heat modality I chose to do is paraffin. Before I set up, I want to have my athlete wash and dry their hands. I want to inspect the skin to make sure there's no open wounds or skin irritation that would allow this not to happen. The temperature of the paraffin bath is 116 to 126. The method of heat transfer is conduction. So I want to have her take all her jewelry off. I want to make sure that she doesn't touch either side or the bottom of the tank. She doesn't want to burn herself. And then I'm going to have you dip your hand in 4 to 6 times. All the way down, come up, out, go back in. 3 indications of this would be if she had any hand or wrist injuries, if she had limited range of motion, subacute or chronic inflammation. 3 contraindications would be if she had any open wounds. If she did have an open wound, we could have her put a glove on and then do the same treatment. If she had any skin infections, or if she had any loss of sensation where she wouldn't be able to feel the heat. After she puts her hand in, we're going to put her in the bag, all the way in, and then put the mitt on to hold in all the heat, and she's going to stay like this for 10 minutes.